he'll be at that one. But I guess we can launch into it now. Last time when we talked, I know I'd asked folks what they were interested in for a webinar, and issues around mental health support, self-care, and so on were brought up. And so, and Melina from MCHA had mentioned this free resource that's now available in LA County through, I think, a partnership with the Department of Mental Health in LA County. So we reached out, and very grateful that Prevail Health was able to be here. So just want to welcome them and thank them for taking the time. We have Richard and Sarah from Prevail Health, and I'll let you both introduce yourselves and dive in.
That sounds great. Hi, nice to meet everyone. My name is Richard, and I head up the product here at Prevail in our Prevail program.
Hi, I'm Sarah Hatfield, and I head up people. So I'm gonna turn it back to Richard.
Great. And can everyone see my screen here?
Yes.
All right, great. I have a handful of slides that'll kind of high level talk. So my plan today is just to tell everyone what the product's about and make you understand kind of how to get into it and what it generally offers. So I'll run through a few slides that kind of talk about it high level, and then I'll jump in and show you a demo of what the user flow looks like and kind of how it looks to onboard and use the program. Feel free to stop me with questions, or I'll make sure to leave enough time at the end for any questions. The process for our website, in short, is we start out by finding what users need through a host of standardized assessments, as well as interacting with our network of coaches. Once we find out what they need, we then help make a custom program based on their specific profile and their challenges and needs. With that program, we match them with a dedicated coach or coaches who's with them to work through their structured programs and/or work with them one-on-one as they progress through our ecosystem. And then the system has a points and rewards portion. As you do more things in our ecosystem, you get points for completing those items. And then if you complete enough points, you can redeem those for nominal rewards like gift cards to Amazon and things like that. The first thing that we do when we interface with users is we ask them how they want to interface with us. And we offer them what we call approaches. And approaches let them determine which way is best for them to interact with us. There's three basic approaches that we offer. The first one is called lessons. And these are rich media, e-learning, computerized lessons where we take cognitive behavioral therapy and problem solving techniques, but we've computerized them, put them through a structured computer regime. We take them through clinical trials to prove that they're effective, but you work through items directly with the computer. As you do that, you'll also connect with your coach at various touch points so that they can talk about the lessons that you're learning, make sure that you're progressing in the right way. The second approach is called sessions. And you can think of sessions like traditional therapy sessions. You'll get matched with a lead coach who's specialized in the areas of topics and challenges that you have. And then you'll schedule one-on-one sessions with that coach on some interval. Usually it's once a week. And you'll schedule an hour session, connect with your coach, talk about things with them, and then come back the next week and do that again. And then the last area approach is what we call groups. Groups are like Facebook communities targeting specific challenges and areas. And so we have a bunch of users and a bunch of communities that we've built up, and you can go and be put into those communities and then interact with other users around those topics in a very structured way. The groups are overseen and guided by our moderators who help facilitate those interactions. Once you pick which approach you want to use to interact with us, we'll then pick topics and challenges. You can do that in the system via taking assessments, and through those assessments, we'll build a profile for you and then suggest things that you should do, or you can manually pick them yourselves. We have programs that target basically a whole host of behavioral health issues, pretty much anything that you can apply cognitive behavioral therapy towards. So anxiety, depression, PTSD, stress, and the like. Once you pick your topics, you'll take baseline assessments so that we can get a sense of where you're currently sitting. And then as you progress through the ecosystem in our programs, you'll take follow-up assessments so that we can track improvement over time and show that the improvement that the program's hopefully delivering. As I mentioned, you'll also be matched with a peer coach who will be dedicated to you throughout your journey throughout the ecosystem. Those coaches will be trained up and specialized in the areas of challenges that you have. They've also gone through rigorous training to interact with users and help coach them through the issues and the challenges and the stressors that they're facing. Once you pick an initial approach, you can then mix and match later. You can go back and add other approaches. You can also go and modify your profile so that you add additional challenges moving forward. So if you start with lessons, you can go back and add sessions, and you can have different focus areas for that so that you can enroll in more things in the ecosystem to focus on more challenges as you progress. And then there's a points and rewards component to it. Each structured activity that you finish in the program, you're given points for. And then if you gain enough points, then you can redeem those points for things like Amazon cards and the like, a bit of gaming and incentives to move along and get more done and see more improvement. And with that, let me stop and I'm going to jump over to a demo, but are there any high level questions on kind of who we are and where the program is targeted? All right.
I'll just actually, Richard, yeah, I was just curious if this is something that's been done in other cities, or how much work, how new is this, and is LA County kind of a pilot program, or is this been around for a while?
That's a great question. We've been around for 12 years now. We're one of the early pioneers in this field. We initially got our start in the veteran space, focused on veterans, partnering with the VA and some government agencies to build our technology, which is pretty unique in the marketplace. It's dynamic and tailored. And so we build profiles and give people different experiences based on that. And then it tailors as they move along. We additionally work with a number of large health insurance companies, Cigna, United Healthcare, to deliver this platform at scale. So we've been around for quite a while, and we deliver this at scale in a number of populations now. And we're really happy to add this to LA County as well.
Great, thanks.
Awesome. So here's our main landing page, and you can get there at lacounty.iprevail.com. I'm going to show you this from a demo environment, so I can click around, but it's lacounty.iprevail.com. And on the landing page, there's basically, well, a couple things. One is the site is in Spanish, so if you want to view it in Spanish, there's a view in Spanish button. When you click that, it'll transition over to Spanish for the entire website. And then if you want to click back, there'll be a view in English button to click back to English. For some reason, this is taking a moment. So this is it in Spanish, and then you can click back to English. There's also buttons on the header and footer to go and do that. It's also fully handicap accessible. On the production site, there's a handicap symbol on the right. If you click on that, it'll give you all your handicap enabled, accessibility enabled options. There's two main callouts on the landing page. One is to start a program, which takes users down the structured program environment that I just described. The second one is to click chat now. If someone comes and they want to just connect with one of our peer coaches or coaches right now to have a instant message interface discussion with them, they click chat now. They'll let us know their age and adhere to our terms of service. The next step that they'll get when they try and enter the ecosystem is we're going to check their location. So it'll ask to allow for location checking. We'll go look and ensure that they're in the county. They'll then enter an email, and then they'll get connected with the next available peer coach to have a one-on-one private conversation with them. So basically, in a couple button clicks from any internet connected device, tablet or phone, they can be chatting with one of our coaches 24/7 about whatever issues and challenges that they're having. If they want, they can browse amongst other coaches. If they don't like who they're talking to and they want to talk to someone else and see the credentials of them and pick one that they want, or just have the system pick the next available coach. The other option that they have is to start a program from the landing page and or after they've gone and had a chat with one of their coaches. Once they do that, if they haven't already, they'll check their location, and then we're going to give them some information about what the program is about in the partnership. what the benefits of it, the program are, and how they get started. We're then going to ask them a few upfront questions to get to know them a little bit. The initial questions are demographic questions in nature provided by the county to get a sense of kind of who they are and where they're at, so we can start to build a profile on them and figure out how we can help. Once they're done with that, they'll complete a registration if they haven't yet. And then we're going to ask them to pick which of those approaches that are described that they want to use. Again, those are sessions, lessons, and groups. Sessions are one-on-one teletherapy sessions with a coach. Lessons are structured, dynamic, CBT-based programs that have been taken through clinical trials to show that they're effective. And groups are Facebook-like groups focused around certain challenges that they can interact with other users like them around those topics. Once they pick their approach, we're then going to ask them to pick their topics and challenges that are applicable. There's two ways to do that. They can have the system assess them by clicking Assess My Needs, at which point they're going to start getting some assessments. We give them some indicator questions to build an initial profile, and then we give them some follow-up full clinical assessments to try and figure out what issues and challenges they're having. If they don't want to, they can also just choose from a list. I'll do that here in the interest of time. If they click choose from the list, we're going to offer them all the issues and topics that we have programs that can cover, somewhat tied to what they initially answered. Once they pick the ones that are applicable to them, if they have more than one, we're going to ask them to pick which of those is the primary, so that we can figure out how to rank programs and make some decisions based on that. And once they've done that, we're going to construct a program to offer them. So this user is going to enroll in sessions. Their primary focus is going to be depression. They have a few other additional things that they're going to focus on. If they like that, they can. If they don't like that, they can click a button to change their topics. So if they decide that's not the right profile, they can go backwards and they can update that profile and deselect and select things. Once they're ready, they can get ready to move forward. For some portion of the users, we're going to have them take a baseline assessment so that we can get a baseline of where they're currently at. And then later on, we're going to give them follow-ups so that we can track improvement over time. So I'll take that assessment real quick. This user's primary focus is depression. So we're going to give them something called the PHQ-9, which is a standardized measure for depression. Once they're done with that, we will record that score. So this user scored 20 out of 27, which is above the clinical cut score. They can read more about the results if they want. And if they like the profile we have and what we're going to focus on, they click Get Started to get put into our structured program environment. Once they're in there, we'll give them some tool tips to let them know how to use the ecosystem and the different navigation elements. And then they'll be looking at their homepage. On their homepage, there's what we call a path card. And this is kind of their central navigation element that lists all the things that they have to do here in a structured way in the environment. So this user is in the sessions approach. There's 3 programs within that, an intro, intermediate, and advanced. The first program has 4 levels, and they're on level 1 of 4. And they've got 2 activities to complete in level 1. The first one to go connect with their coach and chat with them. Once they finish that, they'll earn some points for that, and they'll move on to the next activity. Once they finish that activity, they'll complete this level and move on to the next level and work their way through the program. Once they finish that program, they'll then go enroll into the next program, and so on and so forth. So it's organized in a very linear, prescriptive fashion. We tell them what activity to do next. They launch the activity, they do it, and then we tell them the activity after that. Couple things to talk about. When you enroll in any approach, you're assigned, as I said, a lead coach. That lead coach is accessible on the lower left of corner of every page by clicking this bubble. And then when you click that, it'll pop up a message window for your coach. All our conversations are anonymous, private. The whole platform is HIPAA secure and ensuring privacy. So we're going to tell them a bit about that, and they can send a message to their coach. They also have an inbox, and anytime that this basically works like Facebook Messenger. Anytime you have any sort of conversation with anyone in the ecosystem, they'll go into your inbox, and then when you click on that person, you can see the history of your conversation with them. If they're online and you send them a message, then they can respond right away. If they're offline, like this user is, then when you send them a message, when they get back on again, they can follow up with you. So the system allows for both real-time communications as well as asynchronous communications. If your coach isn't online right now, you can still send them a message, and then they'll reply to you within some time frame. You can also, from this page, if there's no one that you've talked with before that's online to talk to, or for some reason you don't want to talk to them, you can browse coaches and look amongst the coaches that we have online to have conversations with. You can also click next available coach, and the system will determine who you should talk to and just connect you with the next available coach. So we make it really easy to have conversations at any time with our network of peer coaches as needed. You can also add approaches. So this user has enrolled in the sessions approach. They can go and they can add approaches, and they'll go to a page that shows them the available approaches. They've already enrolled in the sessions approach. They can also enroll in lessons and/or groups. If they do that, they'll click enroll. They'll once again go look at their topics and challenges that we've selected in their profile. They can either stick with those, or if they want to focus on other things for this other approach, they can switch that up. We'll again ask them to pick a primary. And then once again, we'll take them to an enrollment page that shows them what they're about to enroll into. They're not going to enroll in this structured lessons approach. It's going to be focused on stress. It's going to focus on other things as well. And when they're all ready, they click get started. And then I'll bring them back into their home page. But now this user is in both lessons and sessions. The sessions are the one-on-one therapy sessions in an organized fashion. The lessons are the suite of programs through computerized programs dedicated and focused to certain challenges. So this user's got 4 programs available. The first one's got 5 levels, and they're in level 1. And again, they would click launch to start down the activities in that program. There's also a community aspect to the website. As I said, there's a groups approach, and you can kind of think of it like Facebook communities. We've got a bunch of communities that are, and this is a demo environment, but we have a bunch of communities that are focused on various challenges and topics, and then users can go enroll in those communities. Either on their own, they can go explore our groups and enroll in the ones that are applicable to them, or they can do it in a structured by us fashion by enrolling in the groups approach, and then we will help moderate them through that group experience. As I said, there's a points and rewards portion. As they complete their activities in the ecosystem, each of those activities give points. So this one has 10 points. When they finish it, they'll get those 10 points. And then when they get enough points, they can go to a rewards page and redeem those points for things like gift cards and the like. High level, that's the ecosystem. Let me pause there and ask what questions we can answer about how users find it, how they get onboarded to it, and or what the program offers.
I have just a quick one. When you were going through the, thanks for the demo here. Yeah, that's kind of it's a lot to take in. There's a lot, you have quite a bit going on. I wanted to ask, when you were showing the area where chat is available, first of all, is that staffed like 24/7? Is it available? Somebody always available?
Yep, it's staffed 24/7, and it's available in English and Spanish right now.
Okay.
And we're going to add additional core languages over a time period
Okay, great. And then I was also wondering if there's more available. Is, like, say somebody's doing a chat and just wants to get on the phone and talk it out with it. Is that a feature available, just to be able to talk on the phone?
The platform supports voice as well as video. Right now, we're just rolling out IM text-based messaging. We may or may not expand to voice based on what the county wants. There's kind of additional considerations when moving to voice related to kind of the profile that we have in this, and so we're just IM text right now. We hope to move into voice soon.
Okay, thanks.
One of the key things I want to point out that I think sometimes could seem overwhelming to somebody logging on for the first time is those questions that Rich went through. They're really short and simple. I mean, it's who you are, background, different things. So it's not something that those questions will take them a half hour. It's, as you can see, he can flip through it very quickly. And so I think sometimes people think they have to do this whole assessment and study. They can choose to do additional ones if they want to, more detailed ones, but the first couple ones are very simple. They're 5 or 6 questions.
Yeah, and in summarizing the user flow, they come to the site, and if they want, they can chat with someone right there. So for lots of users, the benefit they get from the program is that we have this 24/7 network of coaches that are online ready to chat with them, and they can get on-demand support when they want. For the other ones that want to go into the structured program, the onboarding is basically a couple steps to create an easy account. You go and let us know how you want to interact with us. We go and get a sense of what challenges and issues you're facing so that we can structure the programs, and then we enroll you in a structured environment to work through those challenges and issues. There is a lot going on there, but it's pretty intuitive and linear. So once you kind of start down the paths, it guides you with some guardrails right down into those paths. We have a lot of programs in the offering, basically targeting anything that you can apply, behavioral issues that you can apply cognitive behavioral therapy and problem solving techniques towards. But really the heart of our envelope, if you will, are stress, depression, resilience building, anxiety. Those are our core programs and our core environment. And we've got a lot, this program's in front of millions and millions of people, and we've got a lot of experience and evidence around tackling those challenges and issues remotely.
The other thing I want to point out is on the page
during the lessons, are you guys doing like CBT exercises and kind of more of the standardized evidence-based practices?
Yeah, exactly. So essentially in the structured programs, you'll come and you'll watch interactive lessons, which are rich media, dynamic, video-based lessons that go through the core concepts of CBT. You'll then do tools that align with that. So, problem-solving tools, you'll schedule activities and the like, and then you'll go connect with a coach to talk about what you learned in your lessons, or the tools that, the tool entries that you've made and gone through, is essentially how the programs are organized.
Okay, and are you guys using the trauma-focused model?
So we definitely can follow up with some more kind of detail on what each of our programs, each of our different programs are very different. They generally focus on CBT and problem solving, but we have different clinicians that build each of our programs that have specialties in the various areas that we have programs in. And so in our PTSD program, yes, but we can get you a better listing of kind of what's the core tenets behind each program.
Great, thank you.
Of course.
The other thing I want to share is the screen we're on right now, the lessons, where it says, level 1 of 5. People can move at their own pace. There's no time frame on it, but it gives an estimate underneath. So where it says interactive lesson could take anywhere from 5 to 10 minutes. Someone can start it, but maybe they get interrupted, they can come back to it. Maybe they do the first couple pieces because they can, and then they come back a week later, they could come back an hour later, they could come back a month later. So it's up to them when they want to return, but it stays where they were at.
I have a
Great.
question regarding, I'm sorry, just a quick question regarding that feature that Sarah just mentioned. Are they able to go through, say they may want to skip the basics part, are they able to get to the strengthening and improve your thought patterns, for example, or is it sequential in that they have to finish the basics, move into the second one before they can continue through?
Well, for this program, once they finish the basics, they can take either one of the next ones after that, but they got to go through the basics first for this regime. But our lineup of programs, it is a very dynamic program. We build profiles on users and we build profiles first, and then from those profiles we determine what we're going to give you. And so the programs change based on what they're in. But for our core programs for depression and anxiety and stress, there's a basic lesson that you do. It's not very long. It's like 5 levels long, and then you move into some of the other ones that you can then pick in any order.
Thank you.
Of course. Great. Any other questions we can answer? Awesome. Well, I appreciate everyone's time to see the platform, and we'll follow up here with some more materials on how to access it, how to spread the resource to others, and let them know how to get there. But we really appreciate everyone's time, and we're excited for the partnership.
I'm sorry, I just came up with another question, real quick. I think it's a quick one. I was just wondering, in the area when you showed the different groups, the kind of community, I guess it was called the community area. Is there anything specific to kind of the population that we serve, which would be related to perinatal mental health during pregnancy or postpartum?
Yeah, this is a demo environment, so we can click around on our live production environment. There are a couple of groups related to that. Let me go find out and get back to you a list on that. Of note, also, we do have, not part of we have some programs related to those issues that come into the mix there and have some experience in that issue. We have a dedicated program for postpartum depression. It's not actually part of this suite right here, but we're hoping to add that pretty soon as well. And if there's interest in your population to have that, we love to have a discussion about getting to that sooner than later.
Great. Okay, thanks. Anybody else? Any other questions about this? I know when we had talked about this earlier, it was in part, I thought this could be something that we all should know about to share with families. It's a useful resource. But then also in our last discussion, we were talking a little bit about, our own mental health and our own, concerns, anxieties about getting back out in the community and so on. So kind of looking at this both ways as something that we could all use, or as something we can share with families. I don't know if anyone has questions on either perspective or neither. Any other questions or comments?
No, this would be a great presentation for the RNs and the PCs as well. I don't know if you're planning that one as well.
Yeah, well, we are actually recording it, Denise, too. So we'll post this to share with them. And then if there's information, Sarah and Rich, that you would like me to pass along, I'm happy to do that in a follow-up email to everybody as well, or to share with our whole network too, like the PCs and parent coaches and nurses that Denise mentioned.
So one of the last questions that came through on the chat is whether there's a subscription fee or a fee for this. Right now in LA County, it is free.
Oh, go ahead,
Sorry,
Steve.
go ahead.
I was just going to ask a little bit more about eligibility. So you mentioned it's free for LA County residents. during the presentation, I saw that, or there was mention of just making sure that they are in LA County. Could you expand a little bit about that? Like, say somebody is in an LA County resident, but they're trying to access this outside of LA County area, an LA County area. Is that going to be allowed once they've created their account, or are there some limitations there?
There are some limitations there. Right now, it is location checking in the county, as per the arrangement of how it was set up. If someone tries to access it outside the county and they can't, the message that will display that they can't can direct them to our help desk. And if they send us a help desk message and let us know that they're out of the county, we'll figure out how to make an accommodation for them.
Great, thank you.
Do you have any sense of how many folks are using this now in LA County? I mean, how much has it gotten out there and taken hold?
Well, I mean, we just started here last
Yeah.
month.
Okay.
So there's a marketing effort that's coincident with this coming along. So right now we're trying to build stakeholder awareness, community engagement, and then rolling into kind of a full-fledged marketing effort. So we're just at the very beginning, but we're excited about how it's going.
Great. All right. Thanks.
Awesome. Any other questions? All right. Well, once again, we appreciate everyone's time and hearing about the program, and hope that you find it interesting. We'll follow up with some materials, and we're happy to have any other discussions with any other groups that you think would benefit from this.
Terrific. Yeah. Thank you, Richard. Thank you, Sarah. Appreciate you both
Great.
taking the time to go over all this with us.
Right.
Great. All right. Everyone have a great rest of the week.